Welcome to Wax Off. My name is Robina Rayasat and I'm a hearing aid audiologist. I'll be talking through our earwax removal videos, so let's see some wax. This patient, let's call him Davos Seaworth. Like a lot of my patients, Davos knows exactly when his ears are blocked as he gets a whistling sound on his hearing aids. And his wife also lets him know he isn't hearing well. So I see him every 6 months just as the blockage is about to seal off. Here we're starting with the right side. You can see that the earwax is light in colour. He is prone to a little bit of an infection now and again, although there was no evidence of that this time. The wax is going straight into the tube, and as I'm going in to clear the areas around the periphery, there's lots of oil on this side, by the way. The golden wax that you see here is suddenly sucked into the tube, and what's revealed is a mother of pearl, really thick keratin layer, which is quite unusual to see. It's gone right up into the tube. Now I've gone back in here because Davos is quite sensitive to the clarinetting that we can get sometimes. So to reduce that sound, I've used a fine tip, and that's pulled it away really beautifully. A nice still shot here showing just how beautiful that colour is. Again, very, very unusual. And you can see the underside there. So now it's neatening up time for the few areas of keratin that are still hanging around. And we're going back in with the probe now. A little bit of chop sticking there going on. But there's no areas where the hairs are, where the wax or the keratin is ready to come off. So I'm aiming for that area at the back, which was attached to the mother of pearl keratin layer, and that's beginning to come off. We're trying some of the areas on the other side of the canal wall here to see if they come off. Little bits are coming off, but nothing spectacular. Now I'm going back in for that area which lifted up and then came back down, and a blanketing technique there has done really, really well. It's come off. And you can see how the skin is getting thinner as we go deeper into the ear canal. So here is the final shot of the right eardrum. Pretty healthy looking. Part of the ear canal wall is hiding the anterior part of the eardrum, which is the part closest to the front of the face. And there is a little bit of keratin still remaining on the canal walls, which are not ready to come off. And I've tried to get the best view for you there. And that's the final shot. So now we're going over to the left side. Immediately you can see the wax is very dark here, and it's not because it's been in there longer, it just never is the same colour as the wax on the other side. Now, as the probe goes in, immediately the end of it latches on to the dark wax, goes in quite nicely, attaching on the end there. So here we're doing the blanketing technique as well, trying to get bits from either side attached to the end so suction increases and everything is lifted out. There we go. Again, the same blanketing technique. So it's lifting up the keratin that's ready to come off. Now, the keratin is also thick on this side, but not as thick as the other side. Now here we are going back in to try again, this time with the fine tip. Again, because of the noise, Davos is extremely sensitive to any sort of suction noises, so I'm always very careful as to the type of tip that I'm using or the amount of sound. Now here I have switched to a pair of alligator forceps because it doesn't seem to want to come off very well. I'm not going to try to get off every single bit, but I want to make sure that we're getting off as much as we possibly can. There is a little bit on the left side here. So this last part, we're going back in with the alligator forceps again to see if I can grab hold of it, but it's very thin deeper down, so not as easy to get with the alligator forceps. So we're giving it one last try with the suction probe. You can see there is a little area where it's a little bit red there. It's probably caused by a nick via the procedure when the view wasn't great. Here's the final shot of the eardrum. There is a little bit of keratin remaining on the left side, and like we were saying, there is also a little red area which we can get sometimes. It happens now and again, and I think it was time to leave that ear alone now for Davos, and he was quite happy because he could hear from his hearing aids. That will heal up very, very nicely in time. So thank you so much for watching episode 21 of Wax Off. Please keep your questions and thoughts and comments coming in, and of course it goes without saying, please hit the subscribe button for our weekly videos which come out on a Thursday or a Friday. Hope you're having a lovely day wherever you are, and I will see you in the next one.